Across Oklahoma, too many families in rural communities are struggling to access the care they need. Whether it's finding a local doctor, keeping a hospital open, or getting timely treatment without driving hours away. As someone who lives in rural Oklahoma, I understand what's at stake. Healthcare isn't just a policy issue, it's personal. And if we're going to build a stronger, healthier state, we have to start by listening to the people on the front lines. That's what this episode is about. Real leadership, real solutions, and bold ideas to fix what's broken in rural healthcare. Let's get to the conversation.
This podcast is authorized and paid for by Friends of Gentner Drummond 2026.
Welcome back to Bold Ideas with Gentner Drummond, where we talk with leaders who are shaping the future of Oklahoma. Today, we're diving into one of the most pressing challenges facing our state: access to quality health care in rural communities. Our guest is Brian Woodliff, a name well known in Oklahoma healthcare. Brian is the president and CEO of Northeastern Health System, which operates hospitals across eastern Oklahoma, from Tahlequah to Sallisaw, Poteau, and Colgate. Over the past 20 years, he's led a remarkable transformation, growing revenues from $30 million to over $400 million, and expanding the team from 300 to more than 1,400 employees. He's recruited over 100 physicians, built new facilities, launched residency programs in rural Oklahoma, and forged groundbreaking partnerships with the Cherokee Nation. Simply put, Brian is one of the most forward-thinking rural health leaders in the country. We're honored to have him with us today to talk about tribal partnerships, rural health innovation, and the policy decisions that could shape the next decade of care in Oklahoma. Let's get into it. Brian, thank you for joining us today. And Gentner, you've made improving healthcare in Oklahoma a very important issue on your campaign. And so I want to pose this question to get the discussion started for both of you. You know, while the goal is all of Oklahoma to have great access to healthcare, we can't avoid the fact that there's a huge difference between rural access and urban access to healthcare. And so what are the real challenges and the differences between rural and urban healthcare?
Brian, I really appreciate you taking time out of your schedule to be here with us. I think that our viewers are going to be engaged and enjoy where we go. And thank you. You're a subject matter expert that I look forward to spending some time with. So I live in rural Oklahoma. Hominy, Oklahoma. We lost our hospital 15 years ago. It's tough. It's a vast difference between living in the middle of Osage County versus in Tulsa or Oklahoma City. So what do you observe in your position?
Well, I think you're absolutely right. Rural healthcare is critical to the economics and the health of small towns. And it's evident that we've got some financial stability problems. There are 81 rural hospitals in Oklahoma. And of the 81, the Centers for Quality and Payer Reform would say 47 of them are on the watch list for their financials. 23 are in immediate jeopardy of closing. And that comes out of the public data, the cost reporting that we report in. And so I think we've got to be really strategic about how we go forward because the cost of healthcare is out of control. And the cost of care is driven by our demand for the best in whether it's for pharmaceuticals or technology or professionals. And rural has a lack of access to all of that. And that's the primary problem.
No, we really do. I appreciate the mission of Oklahoma State. It's Osteopathic College, where they're driving physicians out into the rural communities. But we also have a shortage of registered nurses.
Absolutely. That statistic is similar. Currently, in 2025, in Oklahoma, we have a need for about 36,000, but we need 44,000 RNs. And so I think what's great about having this conversation is I think as governor, you can influence the educational component to drive universities and the technical colleges to help bridge the gap to jobs. I think that's where we could be great. We could be great at technical work for our communities and for rural, and I think we could be a beacon for others. I mean, one of the things I think you've shared with me is your confidence in the technical schools, and I think we should promote them in every way we can. And nursing is an avenue through the technical schools.
I don't know any unemployed nurses. I mean, if you've got a nursing degree, there is a job waiting for you, and they're so critical.
And we owe it to those nurses that have retired after COVID. COVID really burnt out a lot of nurses, and the baby boomers that have retired has hurt our workforce. So if making it a priority is very important, because all those nurses deserve good care, and the older we get, we're going to need it.
How can we make stronger our rural hospitals?
Well, I think your platform is all about smaller government, in my opinion. It seems like you'll be really engaged in the regulatory side of this. If we can get some regulation out of the way and we can focus on caring for patients, I think you'll see a lot more creativity, a lot more innovation. For instance, I think the more AI we can involve in the care, we can deliver that in remote areas, right? The more telemedicine, we can provide that in remote areas. So I think that's an important component. There's also, there's other deep issues between the way our payer system is set up. It's the most complicated business. It's the most complicated industry. I mean, most of the people that will be watching this don't know what the cost of the care is going to be when they go to the emergency room or they go to the doctor, or they get their surgery. And that's because there's so many different ways for it to be covered. And I think if you can get involved in the insurance regulation component to move the paper out and get us back to the patient, that's a lot of cost that we can remove.
You know, it's crazy. I mean, none of us go and take our car in for an oil change or a repair work without talking to the mechanic about what it's going to cost. And yet we go into our healthcare system and we don't know. So there's an absolute lack of transparency that I think if we had transparency, then we would have competition. So for example, if I can go to a hospital, get an MRI for $10,000, but there's an MRI provider down the street that could give it to me for $2,500, I need to be driven.
Absolutely. And I think there's a lot of collaboration that could happen if there's less regulation that gets in the way of that. There are physicians that are eager to partner with providers, and that's a very fine line. But in rural, we should be able to regulate and make some exceptions and protections, some guardrails, so that we can do partnerships, whether it's with for-profit entities that come in or physicians or other providers, tribes, for instance. There should be public-private partnerships. I mean, in Cherokee County alone, I can think of several federal entities, tribal entities, city entities, and private entities. We need to think better about having them work together instead of in silos.
You've loaded up a lot of points there, but let's pivot for a minute with our tribal partners. Inform our viewers what benefit we have with our tribal partners.
Well, living in Oklahoma, you must be sensitive to our founders and the Native American population. Although it's only 15 to 20%, depending on the census data that you look at, they carry a significant weight. I think you helped me learn that 3 of the tribes could be on the top 100 Fortune
500 companies.
Fortune 500 companies, and we need to look at them that way, right? And we need to partner with them in different ways. First of all, they are very wealthy, and they have healthcare as a priority. So we need to put together joint ventures and shared services agreement, because many of them are in rural America where they can make a difference. For instance, they have invested tremendously with OSU Health Science Center in Cherokee Nation in Tahlequah. And we're so fortunate now we have 200 students that are now training in that community. But it doesn't stop there. You can go to medical school in Tahlequah, but where are you going to go to residency? You have to have a residency that follows up with that, and you can make a difference in that.
No, you hit a key point. My daughter's a physician. So many of her classmates that came to Oklahoma to study medicine had residencies in Oklahoma and stayed in Oklahoma. So I think empirically that the physician who has a residency program in this state will stay here. And we don't have enough residency slots. So I think from a public policy perspective, we have to open up our residency portals so that we have more and more out-of-state students that come here and stay here. Secondly, I observe that on the application basis of our medical schools in Oklahoma, a large percentage are out-of-state students. So we're not even raising up enough students in Oklahoma to fill our own medical schools.
It's a good point. And when they get there, we recruit physicians, every day to difficult task in small town America, but they come with a lot of debt. And that's where I think we need to step in as well. We need to figure out how can we incentivize our own to go to rural and work on that debt in low interest tax credits and other creative governmental ideas to make that happen. But we've got to first have a governor that's willing to work with the tribes, because they're in a position to help us do this. They have prioritized healthcare, and I think rural as well.
Well, there's a path. I mean, I think that we in Oklahoma, we investigate, prosecute, and incarcerate better than anybody else in the United States. And the tribes illustrate a true passion for healthcare and mental health care of their tribal members. And I think that there's a path where we can partner. We can take the cacophony associated with criminal justice and solve that issue with the tribes in partnership, and in return, tap into their expertise in mental health and healthcare.
Well, and many of the issues that face rural Oklahoma are in mental health or in primary care, like was highlighted earlier about the lack of access of the health professional shortages. As it relates to mental health, it's 100%. All 77 counties have a shortage with mental health. And so I think I would encourage your administration to focus on mental health. And I think in partnership with the tribes understand their communities that you can't solve the mental health problem or the health problem if you only solve the tribes problem, because we all live and work and commune with each other. So we can't be divided on these issues.
No, we can't. In 2021, Oklahoma passed State Question 802 that provided Medicaid expansion, and many were fearful, anticipating what would happen if we became dependent on the federal government providing these sources. And now it looks as though that might be right-sized with the big, beautiful bill, but with dedicated funds to rural Oklahoma. I'm wondering if a solution to Oklahoma's dilemma is maybe providing more workforce opportunities for our people so that they get outside that poverty level and no longer need the Medicaid supplement.
That's a great instinct. I think what people need to understand is we have to have someone in your chair that has the instincts that good business makes a healthier population, which makes it less dependent on government, and that's better for all of us. The more that are insured is the intent of that old State Question 802 is to have more insured, but your pathway is more insured and less dependent on government. And I think that's a great instinct.
I think we have to get there to survive financially as a state, to provide more opportunity. And it's all integrated, from our educational system to our deliverables in mental health and healthcare and workforce development. We have to get there. We deserve better as a state, and we can do better.
Yeah, and the other thing that you've said to me that I think is important for us to flesh out is the work that the technical schools are doing, and Brent Haken and that team. We talked a little bit about this micro philosophy that, the dirty jobs are being educated in Oklahoma in a really effective way. And I think the more that graduate through those programs and the more value we put on those programs, I think the young people in Oklahoma will really gravitate to them. Those are the first responders. Those are the nurses. Those are the heroes. Those are the energy drivers. I'm really excited about that.
No, I value the secondary education systems of Oklahoma, but our technical schools are untapped. Absolutely. We need to elevate and provide alternatives for our young people, inform them and drive them into that, because like you said, those are the ones that are on the front line of delivering so much of the work that must be done, and at a wonderful per annum rate of remuneration.
Absolutely, and there's a job waiting at the end. That's the key to the future, I think, and I think business will be right there with you. But we got to have a governor that has the instincts, first of all, to think about partnering businesses with education, and then implement. You can have a goal of being top 10, but you also you have to be curious about the methods. And I think you just described a method that would help us.
We've got some remarkable examples in rural healthcare. I was recently at Comanche County Hospital. They are doing remarkable stuff there. Eastern part of and in your country, in Tahlequah and Muskogee, just some remarkable examples throughout our state. We need to monopolize and take that kind of synergy and leadership and spread it across the state.
Well, I've been doing it for 28 years in Oklahoma, and I've made plenty of mistakes. So I can definitely highlight to anybody who wants to talk about the mistakes for sure. But I do think the key, I know the folks in Comanche County and Cherokee County, the uniqueness of those is that it's relationship building and the partnerships that they've had. And I think with a legislature and a governor that respects the relationship building and moving the barriers and building the relationships through joint ventures or other shared services arrangements will be very helpful.
Now, you mentioned the private-public partnership, but when we layer in the tribes,
absolutely,
that's going to be just monumental, I think, for our healthcare deliverables throughout the state. Well,
and it has to be someone who can meet with them. I mean, at least, right, that can bridge that gap. And for all of us, we have some making up to do, and I appreciate your taking the lead and making sure that we get there.
Well, every Native American that lives in Oklahoma is, by the way, an Oklahoman.
Yeah.
Right. And we need to all be on the same team. There's only 4 million of us. We have to row in the same direction. And I think we've got outstanding tribal leadership that are truly committed to our communities. And I loved witnessing the Cherokee Nation. Say that the priority that they've placed on healthcare throughout each of their counties, the water floats us all.
Oh, yeah. I think the results are amazing. I mean, look at the life expectancy in rural Cherokee County, and you compare that with other counties around the United States. There's access to care, and a commitment is made a difference there. You live 4 years longer there than you can in similar counties in Oklahoma, and it's a tribute to their commitment to healthcare.
I think we need to model that throughout the state.
Absolutely.
I'd like to bring something up that you guys started to touch on. But first, I think for a lot of our listeners, maybe they don't understand just where Oklahoma stands compared to the rest of the nation when it comes to healthcare. 75 of Oklahoma's 77 counties are officially designated as primary healthcare professional shortage areas. Oklahoma ranks near the bottom nationally for number of active primary care physicians per capita. In rural areas nationwide, just 5.1 physicians per 10,000 people practice versus 8 physicians in rural or in urban areas. And most of Oklahoma being rural, it creates problems. And I mean, the problems exist with nurses and everything. So there is an access problem. But you guys hit on a really important subject that I don't think gets explored as much. If the economy does much better, we create more high-paying jobs. We bring more businesses to Oklahoma. Our kids are getting educated better in kindergarten, first, second, third grade. We have better access to technical schools. Do you see that as a way of improving the healthcare system in general by people maybe not needing as much care?
Well, I would observe that everything is interrelated. And it seems as though we as a state have taken our eye off the ball of this integrated approach to measurables that will bring us all up. It's not chasing after the Panasonic and throwing tax dollars at them. It's taking the third grade student and making sure he or she can read. It's providing the services that they need, healthcare, mental health, workforce development, opportunities for parents, and then our young people that are coming out workforce ready. And if we all make a little bit more money, then we all are eligible for the insurance that we so desperately need.
Absolutely.
And I think it works. I'm excited.
Yeah, you've touched on some things, and I think to get the attention it needs, it's going to take a governor that focuses on it and understanding that in a state with 77 counties, 81 of them are rural-ish, have hospitals. Only 22 of them can deliver a baby. And what's hard about that is there's this distance. And when you begin to put distance between healthcare and an individual, it begins to diminish their thriving. And we have statistics that hurt our medical outcomes. We were talking earlier about if there's not a hospital where you can be born, you never say you were from that town. You were born somewhere else. And there's a psychology behind that, and there's an economics behind it. And then there's a health outcome behind it. Okay. Similarly, trauma under the age of 40. Under the age of 40, the number one killer in Oklahoma is unintended injury or trauma. And that means you can't get to a trauma surgeon or a board-certified emergency room physician very quickly. There's only 25 hospitals in rural that have it out of the 81.
So the fact that only 22 of the 81 rural hospitals in Oklahoma can deliver a baby, and only 25 of the 81 can handle trons.
Exactly. And so knowing the problem and then putting the incentives, like we've talked about, the education and the partnerships to deal with those problems, you'll have healthier populations that thrive in their education, and leads to your fundamentally the job market, right? The more education, et cetera.
Related in this subject is, the legislatures have tasked my office with enforcing the pharmacy benefit management rules. It was not being enforced in the insurance commissioner's lap, and it was not something I asked for, but they gave because we perform. It's been an absolute frightening education to see the lag, the opaqueness, and the money, the wealth being generated by the PBM out of state of Oklahoma, which drives up our healthcare costs. But the unintended consequence that I'm observing is that it's driving our pharmacists out of our rural communities. And right now, my healthcare provider in Hominy is my pharmacist, right? I mean, he's still there. That's right. And I want him to stay there. And to do that, we have to make sure that the PBMs don't disproportionately injure our rural communities. So many of us have lost our hospitals. Yeah. So many of the hospitals that are still here are really just transfer stations, right? You come in, the emergency is abated, and you're transferred to Oklahoma City or Tulsa. Right. And then lastly, our pharmacists that are just being driven out of business. We have to do better.
If 100 PBMs moved to Oklahoma, you might have a different argument. But that's not the case. All of that income is going out of the state and hurting small mom and pops that can't compete and make a margin. And so it's a trickle down effect, and those costs continue to rise. Now you have a lack of access and you have bad outcomes.
Right. I also was visiting with a group of physicians a month ago, and they were complaining that prior to this current administration, the healthcare authority processed all the payments.
Yes.
And we have outsourced that now. Yes. The governor was very passionate about privatizing reimbursement. So now there's a company in Arkansas that's making a lot of money off of the backs of Oklahomans. But I don't like that philosophically, but what was most impactful to me in that conversation was that under the old administration, a physician submits an invoice for payment, they were being paid within that week through the healthcare authority.
Max.
Now those dollars are being sat on for 90 days because we've outsourced it. So it's really impairing the ability for the physician to cash flow his or her clinic and office.
I know, absolutely. And I think it may be counterintuitive to be thinking about how outsourcing can slow things down, but it's profitable to slow things down in this model. And that's what's messed up about the system. It might not necessarily need to be insourced to the government. It may not, but we got to get back to efficiencies so we can count on our cash flow. And that may mean that providers need to propose an opportunity to be a payer. And I think you might see that, and the regulatory environment needs to be right for payers to move into that space and sell that product. And so we can pay ourselves and set those terms. And I think that's another real opportunity to see that with community care, expanding its reach, the St. Francis and St. John's provider model. And I think it could be an example for us to build on for Medicaid and other.
A lot of areas for us to work on.
Absolutely.
And I so appreciate the opportunity to visit with you, who are an expert in this industry. And I want to be informed. I want our listeners to be informed as well, that we can do better as a state, but it's going to take dedicated, devoted public servants who are committed to this cause.
Yeah, thank you for listening, and we really appreciate your thoughts about rural healthcare.
Brian, it's been great. Thank you. Had you with us.
If you found this conversation helpful, I hope you'll subscribe to Bold Ideas with Gentner Drummond on Apple Podcasts, Spotify, YouTube, or wherever you get your content. And visit drummondok.com to learn more about Gentner's vision and how you can get involved in his campaign. Thanks for listening, and we'll see you next time.
This podcast is authorized and paid for by Friends of Gentner Drummond 2026.